I'm Lindsay Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. It's commonplace for leaders in healthcare and government to praise nurses as the backbone of the health system and applaud their dedication. But today's guest says it's time to walk the talk. Dr. José Luis Cobos Serrano is in his first year as president of the International Council of Nurses. And upon assuming that post, he made it clear he is going to push policymakers to take action to provide nurses with the support they need and will pursue an agenda of empowering nurses themselves. Dr. Cobos has spent many years as a clinical nurse and as a senior leader in Spain's nursing community, including as director of the Spanish Institute of Nursing Research and third vice president of Spanish General Council of Nurses. He's also making history as the first Spanish global leader of the world's largest health profession, and he's been a powerful voice for elevating and empowering nurses worldwide. I'm excited to hear his insights on the evolving needs of the nursing workforce and what it will take to strengthen healthcare across the globe. Thanks so much for joining us today.
Thank you. Thank you so much. It's a pleasure for me.
So let's start things off by learning more about you and what first got you interested in medicine.
Thank you so much to invite me to have this opportunity to explain what is my vision in my currently actual position in the International Council of Nurses as president. But of course, before, the most important thing is I am a nurse. So during a long time, I work in a hospital in traumatology service. So as all nurses around all services in the hospitals, sometimes in primary care. So I have very long time experience in the clinical practice. After I had the opportunity to be in the same position as a director of the ongoing training in the hospital and continuing education with the direction of the hospital in a big hospital in Spain with 2,000 beds, so very big. So a lot of 2,000 nurses. So I think I had the opportunity with that vision as clinical practice and with management, the ongoing training and continuing education. And after I have the opportunity to contact with the Spanish General Council of Nursing. It's the regulatory body, it's the national association here in Spain, to develop a big project as a research with 5,000 nurses to analyze what is the nursing practice, how we can implement care plans in the hospitals and other areas. So again, a new opportunity to learn first and after to practice in the research area with a lot of people. I study a little bit more with a master level and doctoral level here in Spain. And after I introduced myself as a director of the Research Institute, the Spanish Research Institute for Nurses, after at the political level, during the last 6 years, I participate in the structure of the political level in the Spanish General Council of Nursing as the last moment as vice president. During the last time, because I work like an international affair for the international topics, I had the opportunity to work together with ICN during a long time. And in the last mandate, I be in the board as a member. Now I had the opportunity to present my candidacy for the presidency. So I presented the candidacy. A lot of people invite me to and support me from Latin America, Europe, Africa, Asia. So it's not in my first idea to present the candidacy, but I understand this is a very good opportunity. I have a very global vision, expertise, experiences. So I think it's a good opportunity. For 4 years, I have now this privilege to be the president of ICN. So for me, it's a pleasure, it's an honor. And I understand, like in other areas, in the clinical practice, in the research, as a teacher, because I had the opportunity to be in the university too. So now is another time to offer all my experience, all my capacity for all nurses, of course, and for all health systems that we can provide. And of course, if I can change something, I'm here to work.
That's awesome. I love hearing what got you started because I think it gives us all a feel for kind of what pulled you into this really important work in the first place. What you said there, I liked that you're a nurse first, then you get into research, then you start getting involved with the International Council of Nurses, also known as the ICN. And that's what brings us to where we are today. So for those who may be unfamiliar, can you provide us with an understanding of the International Council of Nurses and what its mission is?
Yeah, it's very important to understand our organizations. First of all, in each country, we have some association, council. There are a lot of names to define what is the institution represent the nurses in the country and what the institution that defend not only the position of the nurses and the job or working condition or something like that. I think it's very important to understand we defend what is the competencies, what is the job in the hospitals, in the primary care centers. And this institution is very important for us in each country. Around the world, we have a lot of. In our institution, that is International Council of Nurses, is the institution that want to be the global voice of nurses around the world. It's not the word that I can explain in front of the governments or the ministers, that we can analyze what is the situation of the health system and what is the contribution from the nurses. And this is very important for us. So our first mission is to be the voice of the nurses and to provide what is the most important things that we can provide for the health systems. So we analyze what is the situation, for example, in mental health, in primary care, with chronic diseases, all things that we can analyze, and we can provide some policy statement or some documents, sometimes it's very technical documents, to provide our nurses and our association what is the situation and what is the things that we can provide in each country. Of course, if we are 30 million of nurses is the biggest number of the health professionals in the health systems. So it's very important to understand that we have very strong organizations and we have the opportunity to represent at the international level, for example, in front of the WHO or ILO, UN. So all international organizations that discuss about health, about care, about all providers, in this case with nurses in the health systems, be sure that ICN as organization will be there in all events, all meetings that is necessary to hear. And I like to say to listen us is very important, this mission for us, to provide to all things that is necessary, is not only, as I said, to defend the position of the nurses. What is the mission of each nurses? So this is our first and very important mission in front of the all international organization. After we have to provide some services for these NNAs, National Nursing Associations, or some groups, societies, scientific societies, or academia in the university for nurses. So we analyze every aspect or every topics that we can provide some information. It's not easy, but we provide, for example, some standards for unify what is the global vision for the studies for nurses. So for our students, it's very important to understand that it's necessary clinical practice and, of course, what is the topics in the curricula at the university level, and provide not only the first level, some opportunity to go to the master level and doctoral level. Now, it's very important to understand that nurses are prepared for all things. Leadership, management, research, everything, as every other professionals, doctors, physicians, pharmaceutics, all professions that are in the university is the same for nurses. A lot of things and important mission.
Yeah, that's a really great explanation of the mission. And I think it really highlights the scale of ICN's work and really why it matters. It's my understanding that it represents more than 140 national nursing associations. And then you mentioned the 30 million nurses worldwide, really giving the profession a unified global voice. As I noted in my introduction, you have established a theme of empowerment of nurses during your presidency. Can you tell us what that means to you and how you are trying to put that into practice?
I think this word is very important to understand my point of view because, of course, you can read a lot of definitions in a dictionary or every books. But for us and for me, when I present my candidacy, I said a lot of nurses have into themselves a lot of knowledge, a lot of competencies, a lot of things and capacities. How we can provide in the health system this knowledge, all capacities, because sometimes the health system don't give this opportunity. During a long time, if some people ask to the citizens, the population, what is a nurse? What do you mean that is a nurse? Oh, I think it's one person, not professional, one person that help doctors to provide medicines or something like that. It's true. During a long time, we participate as a profession with collaborative area and competencies, but now we change something to provide as autonomous activities as a other professional with a vision, with a multidisciplinary team. So I think we have to use this capacity. So if we use this capacity, I said we empower the professional, in this case, nurses. I suggest 3 levels of empowerment. First of all, is the opportunity to empower our organization, ICN, International Council of Nurses, in front of the international institutions. So we provide all capacity that we have as organization to defend, as I explained before, all things that is necessary in front of this institution. Secondly, it's important to strengthen, use the capacity and the empowerment of the national associations, this organization, because they have a lot of capacity. We said to our organization, sometimes it's necessary to go with this national organization to the government and to the Minister of Health, for example, to analyze something. So this capacity from ICN and the National Association organization, we have to strengthen to provide more influence, because our intention is to help the health systems to provide more capacity and, of course, to provide and have healthy communities and population. And finally, the third level is to strengthen and use the capacity from each nurse. So we have to use the empowerment in each nurses. What is your capacity and what is your vision as a nurse, individual nurse? What can you provide in your health system, in your institution? So it's very important to be proactive Of course, we help you with ongoing training, with other things that is important, but it's necessary that you understand and you believe in yourself that you have the capacity. Because we can say it's very important, the leadership, but if you don't believe it's possible for you, nobody go to, for example, in the Congress as a congressist or parliament in the parliaments at the political level. So nurses during a long time are in the second line at the political level, for example. So we have a lot of capacity now. We have the opportunity to improve this capacity.
I appreciate the way you frame that and walking us through those three different levels there. I want to come back to that third level. You are also calling on nurses to empower themselves. What are some examples, real life examples on how they can do that?
At the first, with the nurses is very important. For example, leadership. We provide some opportunities with some programs, for example, in ICN. We have an academy for the leadership center, and we provide some programs. For example, in Africa, we have the ODENA program, and this is an opportunity where they have the capacity to learn more about leadership. So this is one example that they can provide more things at the leadership level. Of course, ICN as institution with other institution, we provide this opportunity. Now we extend, for example, this program in Latin America. We have sponsors for that because it's very expensive, so we need money for that. This is one example that they can introduce at the leadership level. In other levels, for example, if we have the capacity for the primary care centers or mental health or all this capacity, we have some examples. We have an initiative with the BBC. We have some videos and we provide some examples around the world in the clinical practice, in the research area. So there are a lot of examples that you can see in is 2 or 3 minutes of this video where they can look at some example. We invite all students or new nurses that some people thinking about what is, for example, the area where I can work, or what is the situation. It's only in the hospital. No, we have other areas. And we provide this example because it's very important to show. For example, this morning I had a meeting with the military area, and we have nurses in the military area. And of course, there are sometimes areas that nobody know about that. In the schools, for example, with children, how we can provide the nutrition, exercise. If we provide this information for children, maybe in the future, for adults, we have more healthy society. So there are a lot of examples where we can provide these capacities and these opportunities.
Those sound like some amazing resources that we can direct our listeners to in the show notes. I want to kind of switch gears a little bit and talk about some of the challenges that nursing is facing today globally.
The challenges is very interesting. I think this is the opportunity. Let me to share with the audience that in my experience, at the beginning, when I I talk about my background at the beginning, and I said, I have the opportunity to work with the Spanish Council of Nurses. And I said, maybe I go, because during a long time I work with the clinical practice and with patients, so very active. So when I think, maybe I go to a desk, for example, and I have to think a lot of things. And some people said, yes, but that people is in an office, but it's the job for there then. So I think it's very important people to think what is the future of the health system or the work for nurses in 10 years, 20 years. This is very important. So when we have to think about the challenges, for example, about competencies, in the last 20 years, I work very hard and with a strong position in nursing prescribing, for example. This is a very important challenge to implement new competencies in our health systems, and the capacity of nurses for that is very important. The population and the citizens now is changing. Our vision is now increasing the chronic diseases, for example. Population are aging. So maybe we have to change the vision of our providers. During a long time, we provide in acute situations with very important hospital. This is very important. We invest in technology or something like that. But what about the chronic diseases? It's necessary to increase this professional that care in chronic diseases, and the professional that is expert in that are nurses. It's very clear. For us, it's very important. So the challenge is to go to the government and say, please, you have to invest in nurses, because a lot of people and a lot of politicians said, oh, you are very important. Your contribution is very important for the health system. I hear every day that words. I think it's important, but I said, thank you so much, but don't talk more about that. We need actions. We need acts that you provide that. We are a backbone, they said, for the health system. So please, it's necessary 6 million of nurses around the world now, if we can provide the health to all people. So now is the time to invest in nurses around the world. But it's necessary money, of course. It's necessary to provide more capacity in the universities and working conditions, something like that. Because I think we have a problems, for example, to retain the nurses around the world. This is a global vision. Sometimes the working conditions are not very good. So we understand that it's important to care the career. So if nurses have more or better working conditions, maybe we can retain all people in the jobs. There's some, last week I had the opportunity to show a new movie in the cinema. I don't know if the audience know that the film is from Switzerland. The protagonist is a nurse during one day in a hospital. The title is Helding, is in German. It's like a hero. I don't want, or I don't like very much to talk about nurses as a hero, because it's other thing, but reflect very clear what is the job in a hospital for a nurse. A lot of things, a lot of pacing for one nurse. So I think it's very important to analyze, and I'm very happy with this film. I invite all people in the audience to go to the cinema to see, because I think this is an opportunity to create this environment. What is the nurse now? What is our challenges for the future? Here is very clear example. Of course, we have some other example to influence. For example, in the leadership area in Korea, for example, they haven't a law or regulation of nurses in the country, and with us, with ICN and the National Association, we influence in the government, and now they approve this law, nursing law, to have the opportunity to recognize nurses as a profession in the health system. In other countries, in Malaysia, for example, the government want to increase the number of hours per week to work for nurses, and we stopped that initiative because it's very important. 45 hours, for example, is incredible because in a lot of countries it's around 35 or 40 in a week. It's too much, but again, it's an opportunity. This is the challenges for the future for our profession. Working conditions, of course, violence is very important because now we know in some areas, conflict areas, for example, in Israel with Gaza and Palestine, in Africa, Sudan, or Lebanon. There are a lot of areas at the big level, in global level. We have some war. This is very important. Protect the health professional, in this case, nurses, is very important for us. I wrote a letter to the General Secretary of the UN and said it's very important because where is the humanity today? If they attack the profession that provide care, is only to save, to provide health people, independent of what is the political situation for us. Of course, everybody have the opinion, but I think for us it's very important to understand hospitals, centers, don't attack them, because if not, I said again, where is our humanity? I think we have to talk about that with big countries and said it's not possible. It's not possible because we help people independent of the countries or political level. I think it's important that there are more challenges for us in this area. In violence in a hospital, sometimes we suffer attack from some patient of the family that are very nervous. I think it's very important to protect our professionals. So in these all topics, we are working a lot. It's important that we provide some agreements into, for example, WHO. With WHO, we work with strategic orientations around the world, and all countries in the last WHO Assembly approve again what is our challenges for the next years. And we provide solutions. It's not only to say all that problems are on the table. Yeah, but what is the solution that we provide? This is the reason because we publish our chapter for change. This is 10 very specific policy actions, very clear to provide to the governments what is the solution that we understand is necessary in our health system. So be sure that ICN, it's not only to say, we have a lot of problems. Yeah, but here are solutions for you. So this is all challenges that we can provide.
I like what you said there at the end, that although you have a lot of challenges, you guys are very solutions oriented as you move forward and work through these different challenges. Shortly after your election, you said that you'd be prodding politicians and policymakers to take action to live up to their praise of nurses. Can you give us some examples of what you've been pushing them to do?
Yeah, I talked some example before, but as I said, it's very important the actions. With my presidency at the beginning of September, I went to WHO office and I have a meeting there to say, I am the new president and this is very important for us to be in contact. Of course, our staff, our CEO, Howard Catton, is in the office and is very close with them. And we have to analyze what is the situation at the health level around the world with WHO. So I have this interview, this meeting, very, very, very early in my mandate. I wrote to the General Secretary, of course, to provide our vision because, for example, in the Assembly of the UN, they approve one very important policy statement about the chronic diseases, hypertension and diabetes, cardiovascular diseases, and they provide a lot of information, and all states, all countries approve this policy statement. But curiously, we analyze there not any comment or reflect any actions with professionals. So they talk, for example, for some problems for cancer of pulmon or lung or something like that. It's necessary to forbidden smoke or to increase the tax for cigarettes or forbidden drugs or something like that. But nothing about what is the role of the professions and the professionals in these areas. So I write that it's necessary to change a little bit. I had some meetings, for example, with the Minister of Health in Spain. I talk because she is a member of the board of the direction in the WHO as representative of Europe. So I talk with her that it's important to increase the investment in health professionals. So I think we need these actions. It's not only to say, oh, yeah, we have this paper, yeah, but what is the solutions in the real clinical practice? Professionals are there. If we said we having enough professionals, we have to invest in the academia and the universities to provide new students, new providers. And after, we have to provide working conditions very well for them to retain them. For example, with ILO, we have convention, it's 149 convention. It's a document that not all countries approve and support, where in this document, we provide some solutions to provide very well working conditions and something like that. So I had a meeting with ILO to influence and to insist that it's important maybe to have an actualization in this convention document. So a lot of activities at the real actions. This is very important for me and for ICN in this moment.
Yeah, you're so right. Action is so important here. And I think we're all really excited to see what else you will do throughout your presidency. I want to talk a little bit about Osmosis from Elsevier. We are a teaching company and we love to fill knowledge gaps. Is there a topic you think Osmosis should make a video about to fill a gap that is of particular concern or interest to you?
I think, of course, the education is very important. In this strategic orientation, we have a chapter very specific for education. And we understand unify the curricula around the world is very important. It's not only in the university at the first level, because after nurses are students along the life, we need ongoing training, continuing education. So there are a lot of providers, as you, that you can provide some topics very specific. Sometimes it's very clinical specific for some diseases or something like that. But in general, I think there are 3 levels is very important. One is research, management, and leadership. For me, I understand there is a gap because research during a long time is not an area that is specific for nurses, maybe physicians, biologists, and other professionals, but not for nursing. Now we have the capacity to be master, doctoral level, so research is very important. The other thing is management. For example, now I'm very happy because last week in Peru, in Latin America, in Peru, the government approved, nominate one nurse as a general director in a hospital. It's the first time in Peru. There are a lot of examples in USA, in Spain, or other countries, but in Peru, it's the first time that one nurse go to this position as general director in a hospital. I think we are very proud for that, because this is an example that we have the capacity. So please, it's necessary the providers have this area that is not very usual to provide for nurses at the management level. And the other thing is leadership. And I said before, we need some nurses in the government, maybe as a minister, prime minister. In some countries, we have some example. In New Zealand, we had the opportunity to have one first minister, or Minister of Health as a nurse. In Spain, not at the central government, but in the region, we have some nurses as regional minister. Of course, first of all, they have to believe that they can do it, but we have to provide the education and the ongoing training in this area, in the leadership. We have global programs in our center, in our leadership center, with Odena and GNLI program, leadership programs, is very important. So I provide you some ideas and some examples that you can explore a little bit more, because sometimes we focus in diabetes, in diseases, or something like that. Yeah, it's important, of course, it's important, but maybe more other topics that are more across the opportunity in the health system is important.
Those are fantastic ideas and exactly the kind of topics that could make a real difference for our learners. So we will take that back to the content team for consideration. And I think it ties in really nicely to what you were saying earlier about empowerment for those nurses. So we do have many students and early career health professionals in our audience. And I wanted to ask you, what is your advice to them about meeting the challenges of this moment and approaching their career in healthcare?
I want to say our students, maybe you choose these studies, or maybe you don't know nothing about what is a nurse, but you are maybe in the university for 3 or for 4 years, in some areas for 5 years. You discover what's a nurse, what is our job in a health system. When you take the hand our patient, I think you charge yourself what is the capacity that you have to provide health. I think this is beautiful. This is the most important thing for us, how we can provide health to you, to the patient. So for me, this is the passion for me, because this is my experience too. I had the opportunity to be a doctor in the university, but I said, no, I select nursing studies because I believe that we are very close to with the patient, and we provide other things that is care for the population and the patient. Be sure that you have, as students, a lot of institutions. Then our challenge is to provide to you one voice in front of the health systems, in the governments, in all areas that is possible. We defend you. We provide you standards and all capacity, and we believe you are prepared for all things that is necessary now in the health systems. Please believe it, that is necessary your job. So sometimes, maybe as this film that I talk in the interview, sometimes you believe, I have to return, I have to go out in the hospital or my profession. Of course, it's not easy. Sometimes we have strong moments and hard moments, very, very, very hard. But believe that you have the capacity. You are prepared for that. Explore a lot of things. Open your mind, open your eyes around the world, this capacity. be careful. Some students are maybe in some areas in India, in Africa, and said, our working conditions are very bad. And I go out, so the immigration now is a problem. I haven't enough time for all topics, but this is very important that maybe sometimes some people or some students need to go other countries. But please, if it's for an experience, it's for increase your knowledge, of course, go to another country and have this opportunity. Now, with the globally world that we have, this is an opportunity. But remember, what is your country? Where is your society, your communities? You have to return, come back to your country, because sometimes they provide you with a lot of money in the universities. You have this capacity to learn and to study. So please believe that we have to be in the future very important and as a real backbone in the health systems.
Thank you so much for that advice. There were so many nuggets in there to pull out, but nursing really is the backbone in our healthcare systems. And I know our audience will really appreciate hearing that from someone with your experience.
Of course, all people, I believe they have the capacity to go to. Now, we have two events very important this year in Tennessee. We have the Advanced Practice Network there. We have a very important conference there in Nashville. So I invite all the audience to go. And of course, our International Congress in Taipei in 2027, in July. So I invite all audience that go there, because it's very important opportunity to share with all nurses around the world. It's around near to 10,000 nurses in the Congress, in the International Congress. 8,000 was it in the last one. So please take in account to these opportunities.
For sure, and two great events to get on your radar. Before we wrap up today's episode, is there anything we didn't cover that maybe we should have?
I think it's a very interesting. Thank you. Thank you so much for your question, because you drive very well this interview to talk about everything. Of course, most important thing is our challenges. The shortages around the world is a very important topic for us, but be sure ICN is your institution that represents you and represent your voice in front of everybody that is necessary. I talk with every institution. I talk with every minister, all that is necessary. Nobody have to understand that nurses are here only to be of expectation, what is matter for the future. No, we know that it's necessary to be actions and to make actions, and so we'll be there where it's necessary. So I think we have very, very good time to provide more things from nurses around the world.
You once said nursing must be at the heart of the solution, and I couldn't agree more with that statement. Thank you again, Dr. Cobos, for sharing your time and vision with us.
Thank you so much.
That brings us to the end of today's conversation. It's one thing to call nurses the backbone of our health system, but as Dr. Cobos reminded us, it's another thing entirely to act on that belief. His commitment to pushing policymakers, elevating the nursing profession, and strengthening support for the global workforce is both urgent and inspiring. With decades of experience as a clinician, researcher, and leader in Spain's nursing community, Dr. Cobos brings a perspective that's grounded in real practice and informed by global collaboration. Hearing his insights on what nurses need now and what it will take to build a stronger, more equitable healthcare system has been invaluable. I'm Lindsay Smith. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisetheline podcast.